Once again, Dallas has landed in the top 20 cities with the worst allergies, according to the Asthma and Allergy Foundation of America's 2025 Allergy Capitals report. Right now, tree pollen is the biggest issue in North Texas, with grass pollen not far behind. And as we get into warmer spring weather, those pollen counts are only going to get worse. Bad news. Here with me now is Dr. Preeti Sharma, a pediatric pulmonologist at Children's Health and an associate professor at UT Southwestern Medical Center. And Dr. Sharma, let's start with parents being able to tell if their child has seasonal allergies. What are the signs?
Yeah, that's a great question because there's a lot of overlap between viral illnesses and allergy symptoms. But usually with allergy symptoms, they last a really long time. So, it's a clear runny nose for weeks on end. And usually there's seasonality to it. So spring is the worst time. And if there's a family history, that may be what you're facing.
So what then are the most common seasonal allergy symptoms that we see in children?
Yeah, so kids generally have lots of sneezing, runny nose, watery eyes, itchy eyes, generally no fever because a fever usually speaks to an illness. You might find them clearing their throat often, or kind of having a small dry cough as they clear the postnasal drip from the back of the throat.
Now, some of those pictures of the kids in the flower fields giving me anxiety,
Yeah.
but what are some of the effective ways to help prevent and treat children that are affected by these allergens?
Right, exactly. Avoidance is probably the first thing to think about, which is, avoid being outdoors on really windy days or days when the pollen count is known to be high. And if you are outside, when you come in, have your child take a shower, or try to rinse off all that pollen that they brought in with them. Keeping the windows closed, running air filters also seems to help reduce some of the allergens inside the house.
Real quick, how can parents differentiate between seasonal allergies and perhaps another virus?
Yeah, hard to do, but usually the biggest key is if there is not a fever, and they otherwise feel okay, energy level is normal, and no body aches or any other signs of illness, it's probably allergies. If there's a fever, their appetite is down, they're just kind of not feeling great, then it may be a viral illness.
Great. Dr. Sharma, thanks for joining us as we head into the sneezing season.
Thank you.